right, welcome to the afternoon session. We have partnered with our Research and Education Institute for several years now, and it's always very exciting for us. I'm Kip Lee, part of the Ventures team. Very excited to be here as we kick off the afternoon. I'm excited, but maybe not as excited as you will be after all of this is over. We're always grateful for our collaboration and partnership. So thank you, Dr. Simon, and the entire team. The afternoon session focuses on applied research in practice, and in some cases, how we've been able to commercialize some of the great research that happens here at and beyond through our in-house engine or in partnership with outside companies and partners. And it often focuses on product development or, as I mentioned, an outside-in collaboration. I want to introduce and kick off our 1:30 session. We've called it our Fireside Chat with Dom Rabin and Dr. Ann Stormorkin from Dom is CEO and co-founder of Exploro, a patient engagement platform that uses an artificial, intelligent 3D avatar guide, augmented reality models, and a series of games to reduce procedural anxiety for young patients coming to the hospital. Dr. Ann Stormorkin is a pediatric intensive care physician with an interest in procedural sedation and pain management. She is the medical director of the Pediatric Pain Service and interim medical director of the Pediatric Sedation Service. Dr. Stormorkin is passionate about creating educational content, implementing clinical practice guidelines to optimize patient experience, and researching patient outcomes in procedural sedation. Someone mentioned before we adjourned for lunch that we may not have cancer as a subject matter, but we actually have lots of cancer care related applications. So we hope that you continue to stay with us. And without further ado, let me introduce you to Dom and Ann for their fireside chat.
Not sure there. Oh, there we go. All right. Thank you so much. So engaged patients and their families have better outcomes. So the question is really, how can we optimize engagement in the area of pediatric procedural sedation? We are fortunate that innovation in the diagnosis and therapy of children's cancer has resulted in significant improvements in patient outcomes. This data shown here, reported in 2018, is the survival rates at 5 years for several common types of childhood cancer in the US. Unpublished data from the largest pediatric sedation database, the Pediatric Sedation Research Consortium, reveals that about 10,000 patients annually undergo procedural sedation for the diagnosis and care during cancer. Medical care for cancer with children, medical care for children with cancer entails very complex diagnostic algorithms and lengthy therapeutic regimens. Children and their families express fear for repetitive painful procedures, such as lumbar punctures or bone marrow biopsies. Lengthy imaging studies, such as MRI or nuclear medicine, often require immobility beyond the child's developmental capacity. The provision of analgesics and sedatives during procedural sedation help to achieve a deeply sedated state, which facilitates these studies and procedures. But when you are a patient or a parent, what you really are worried about during treatment and surveillance is minimizing pain and anxiety and optimizing outcomes. As the first pediatric sedation service in Northeastern Ohio, Rainbow Babies and Children's Hospital is a founding member of the Pediatric Sedation Society and a designated center of sedation excellence. Historically, pharmacologic options were really the only strategy to decrease periprocedural anxiety. But in the last decade, non-pharmacologic strategies have been increasingly and successfully used to mitigate fear and anxiety. And they have the added benefit of teaching coping strategies. This is particularly important when you appreciate that some treatment courses for cancer can take actually up to 4 years in length. So how do we optimize periprocedural education to mitigate fear and anxiety and promote health literacy? There is limited time during every medical encounter to provide all of the necessary information. And within the field of medicine, innovation and education has really lagged behind innovation in medical care. Historically, we've either provided printed materials or video content, with really the target being the adult, not the child. Children, however, are kinesthetic learners, and so they really benefit from education and information that's delivered in an interactive fashion. A recent review has identified important characteristics of successful educational interventions. They include content that is specifically targeted to age and developmental capacity, that is provided in an interactive format and can be accessed on a variety of portable devices, and can be accessed repetitively at home, at school, maybe doctor's office, and this will allow for sort of more self-paced learning. Examples of this include virtual reality, as well as augmented reality. And as you can see with virtual reality, you really need sort of specific, unique equipment, but augmented reality, you do not. And therefore, with augmented reality, this may prove to be more applicable to a greater number of patients outside of the hospital setting. So I'm very excited to introduce Dom Rayban, who is the CEO, founder of Exploro, as we delve further into this augmented reality platform to promote health literacy in children. Dom, I think that's a cue for you, or shall I stop sharing my screen?
Thanks so much, Anne. If you can just stop sharing, I'll share my screen. So I'll just share my screen. And hello, everyone. So it's a great delight to be here today. I'm going to be talking about a co-development project we've been doing over the last year or so with Dr. Stormorken and her team at University Hospitals. And that co-development project uses games and gamification to help a child understand exactly what happens in an end-to-end sedation encounter. But before I go on to that, I'm going to give you some background on how Exploro came about, the problem we're trying to solve, and how we're going about solving it. So the Exploro story begins with this young woman. She's my daughter, Izzy. And when she was just 13 years old, she was diagnosed with Ewing's sarcoma. Thankfully, she's now 10 years cancer-free. But when she was ill, nobody told her what to expect. And that made her feel scared, anxious, and alone. And she was resistant to treatments because their purpose wasn't explained to her. And she was scared of new environments because she didn't know what to expect. And this experience isn't unique to Izzy. Across the board, provision of information preparing patients for treatments is poor, and for children, the problem is even worse. And we know that patients who are poorly informed experience high levels of anxiety, and that can be long-lived and lead to poor engagement with health services and poorer health outcomes. And this lack of information can also create increased risk of behavioural or psychological problems, which in turn can negatively impact both home and school life. But lack of information doesn't just impact the child's mental health. When patients aren't emotionally prepared, this can result in procedures having to be repeated, longer appointment times, greater need for pre-procedural sedation, reduced adherence to medicine regimes, and an increase in missed appointments, all of which considerably increases the cost burden on health services. So putting the problem in context, let's look at just one procedure, MRI scans. So we know that a whopping 91% of patients report feeling extremely anxious when having an MRI. And around 20% of them move because they're not prepared for what's about to happen. So the procedure has to be repeated. And that figure of 20% is from the whole population, not just pediatrics. So the cost of those repeat procedures has been estimated, and this was in 2015, estimated at $115,000 per scanner per year. And that's why many children are given sedation to keep them still, but that costs roughly 3 times as much as scanning an unsedated child. And in the case where children are so anxious about the procedure that they're given a general anaesthetic, that costs a massive 10 times as much as scanning an unsedated child. So you can see, this is just one procedure, you can see how across procedures the costs can really mount up. So that's why we created Exploro, a disease-agnostic patient engagement platform that uses augmented reality, an artificially intelligent avatar, and a series of games to give young patients a voice, making them feel engaged, empowered, and informed whilst having fun at the same time. So this is Exploro. It doesn't require any special hardware, and it's designed to sit on the patient's own device. Firstly, the child creates and customizes an avatar, which then becomes their guide through their healthcare journey. And their guide is always with them, and they can use augmented reality to see their guide in the real world. The guide introduces the child to hospital environments and procedures using 3D augmented reality interactive models, and a series of games allows the child to understand basic medical concepts. Many of these are multiplayer, allowing the patient to form new bonds with others and keep in touch with friends at home. A calendar and mood diary allow the child to take control of their day and record how they feel about events, and that allows physicians to monitor mood changes over time. The guide can also answer any questions the child might have, and to do this, we've built our own AI system that uniquely uses synthetic phonics to understand the ways in which children misspell words. And the child's progress can also be remotely monitored by gathering feedback through structured questionnaires, and the responses can be sent directly to the medical record. But more importantly, from the child's perspective, every time they respond to a questionnaire, they're rewarded with a dance animation that they can apply to their avatar. So a few key points to just highlight. So the first is that our current target age range is 7 to 14-year-olds. We've tested with both younger and older children, and anecdotally had very positive feedback. But we're hoping to have some more qualitative evidence to back this up very soon. We've got a research study currently underway in Spain at Hospital Sant Joan de Déu in Barcelona, where they're evaluating the acceptability of Exploro across 3 age cohorts, so 3 to 6-year-olds, 7 to 12-year-olds, and 13 to 18-year-olds. And we managed to appeal to such a wide age range by using a similar approach to the one that Nintendo use. So what Nintendo do is they've developed a language style that is neither patronizing to older children, but is easy to understand by younger children, and we do the same. So the second thing to point out is that we use a human-centered design approach in everything we do. We've involved patients, parents, and physicians at every stage of development. That human-centered design approach also includes walking in the shoes of our users. And in this slide here, you can see one of our development team having a radiation therapy mask fitted so that he can better understand the thoughts and feelings that the child experiences. As part of our human-centered design approach, we formed our expert advisory board in 2018. Our board is made up of the most amazing experts. They're a group of a dozen or so kids. The oldest member of the board is 16 and the youngest is 8, and they vet everything we do, and many of the features within the Exploro app are co-designed with them. And in fact, they had a significant input on the design of the sedation game that we're developing with Rainbow Babies and Children's. So a really important thing to point out is that Exploro is designed to be used on the patient's own device, whether that be a phone or a tablet. And this is important because we aim to start reducing the patient's anxiety from the point at which they first discover that they have to come into hospital. And in fact, there's really good research evidence that shows that pre-procedural preparation is most effective when it's delivered at least 5 to 7 days prior to the procedure. Also important to point out is that we're all about education rather than distraction, and there's definitely a place for distraction at the time of treatment, but our aim is to provide the child with enough information about what's going to happen well in advance of their treatment so that they're emotionally and psychologically prepared when they come into hospital. And so when we're developing content for Explorer, we try to answer 3 key questions for the patient. The first is, what's going to happen and what's going to be expected of me during the procedure? The second question we try and answer is, what's it going to feel like? And the third is, are there any coping strategies I can use to help me get through the procedure? So does Exploro work? Well, a recent research study showed that children with access to Exploro demonstrated a statistically significant reduction in procedural anxiety, as well as statistically significant increases in both knowledge about procedures and patient satisfaction. And what's more, their parents showed similar results. And you can find that study in the Journal of Medical Internet Research. We've got a couple of studies underway here in the US at present. So at OHSU Dornbecker, in Portland, Oregon, the research team are conducting a 6-month IRB-approved randomized study to see whether children using Exploro require less pre-procedural sedation. And over at Boston Children's, a quality improvement study hopes to show that children using Exploro move less when having MRI scans. And we hope to have initial results from both of those studies early in 2023. So that's enough background about the platform. Let's look at the game we're developing with Rainbow Babies and Children's. So essentially it's a series of mini games linked by a narrative told through a series of cutscenes. And in the game, the child's avatar goes on a quest to find the dreamland. And that quest takes them through every stage of a sedation encounter, from pre-appointment instructions through to discharge. Some of the mini games are multiplayer, so patients can share experiences with other patients and also with family and friends. And the use of augmented reality increases engagement and immersion in the game. And a key factor is that we've baked in replayability, encouraging the child to return to the game again and again. So let's take a look at each of those mini games in detail. The first mini game, Where Did the Paper Go?, is set in a rather futuristic, grand-looking environment of the avatar's bedroom. The avatar has been sent an appointment letter outlining how they must prepare for their visitor to the hospital, but the letter has gone missing, so they have to search the room. As they search, they find clues to its location, and then eventually, once they've found the paper, they can read the instructions and progress to the next level. So obviously the point of this mini game is to understand everything that the child must do to prepare for that end-to-end sedation encounter. The second mini game is called To the Hospital. This is possibly my favourite mini game, and this is a driving game where the route to the hospital is littered with tempting snacks, and the avatar has to dodge the snacks to get to the hospital on time. So this game reinforces one of the instructions in the appointment letter, and that's about not eating on the day of sedation, and it also emphasises that it's important to get to the hospital on time. So I'm just going to play a quick clip from that game. So here I am driving on my way to the hospital, dodging the cheesecake and the chips and jumping over the hamburgers, jumping through the donut there and through this donut again and again over some more hamburgers. And the game's getting, as you can see, it's getting harder and harder as we go on. So I'm just going to jump over that hamburger, but now it's getting quite complicated and I've wiped out. So I'm going to stop the clip there. But now we've arrived at the hospital. We're presented with a puzzle game called Find the Way. And in this game, the player has to piece together fragments of a 3D model of the hospital interior. And this game helps build familiarity with the hospital environment so that when the child arrives in real life, they recognize the rooms and know where they are. So we all know, of course, that there's lots of waiting around involved in any hospital appointment. And on this occasion, the long wait is due to the therapy dog running off with the keys to the sedation unit. So the object of this game is to memorize a sequence of gestures and then apply them to the dog so that the dog drops the keys and the nurse can unlock the department. So now we're in the department. The avatar is being asked lots of questions by the anesthesiologist, and they're transported to an imaginary game show where the anesthesiologist is the host and they're the contestant, and they need to get a high score to progress to the next level. So in this game, the child's learning all about every aspect of sedation. Once they've answered the questions, they're taken through an interactive experience that explains exactly what's going to happen when they receive the sedative. So I'm just going to play you a short clip from that. And as I play the clip, remember those 3 questions that we're trying to answer. So what's going to be expected of me? What's going to happen? Any coping strategies I can use? And what's it going to feel like? So as we go through this clip, you can see that we're answering all of those questions. So in a second, we're going to find out what happens when the nurse comes in. She's going to place the IV, and I'll just let her walk up to the bedside. And there you can see there's a coping strategy. I can have someone with me and ask as many questions as I want. It's telling me more about the IV. And now it's telling me I have superpowers, and those superpowers are staying as still as a statue and breathing deeply. So I'm going to leave that clip there and move on. So now we go on to the next game, which is called Surf the Sedation. And in this game, the avatar is on a surfboard traveling towards the dreamland. Using the game controls, they can perform tricks, and they have to catch the sedation molecules as they go. So there I am, bouncing off the waves and catching sedation molecules as I go, as I advance towards the dreamland. So finally, the avatar arrives at the dreamland, and this is a fantasy 3D virtual world where they can collect objects as they explore the virtual world. And these objects can be used to unlock features if they go back and replay any of the previous games. So as the avatar exits the virtual world, they're then taken back to the treatment room where their caregiver is waiting for them to wake up. So that's a quick tour of some of the key stages in the sedation game. We're expecting development to be completed in Q1 of 2023, and then it will be the subject of a research evaluation led by Dr. Stormark and her team at Rainbow Babies and Children's. So finally, I'd just like to finish up with a message we received a few weeks ago from the parent of a 12-year-old boy who's being treated for osteosarcoma. I'm not going to read it all, but there's one section which I think powerfully illustrates the power of games and gamification when used to help children understand their medical treatment. And it reads, the very next day, in his 4th round of chemo, he shared with his nurse that he finally gets what this medicine is doing to his body, thanks to a game he played on the app the night before. It was amazing. He was encouraged, and for the first time in months, there was a lightness about him. So that child had played a game in Exploro. He'd got 300 points for capturing a bag of chemotherapy, and that managed to change his attitude towards his treatment. So I'm going to stop sharing my screen now and hand back to Anne.
Yeah, thank you, Don. This is a super exciting process that I've been thrilled, and our team at Rainbow has been absolutely enthused to be part of. And were you going to actually moderate, open with some of the questions?
We have about 4 minutes left. I wonder if there is a question from the audience here or online. Dom, can you tell us about some of the learnings in partnering with us? I know it hasn't been, super unproblematic, unchallenging, as it's always the case when you're building something new. And maybe also from you, Dr. Stormark, any learnings as you present as if this has all been so smooth sailing, and some of the animation captures that. But any learnings as we continue to learn, and also for our audience who might be interested in the nature of the partnership?
So I
We
think
might be limited to, yep, go ahead.
No, I think, Kip, I'd like to contradict you and say that in comparison to co-development projects we've done with other hospitals, it has been super smooth. And I think one of the reasons for that is that the sequencing of events was perfect. You know, very early on, we realized that we needed a clinical champion. So you introduced me to Anne, and we then together defined the problem. We then realized that we needed to find money from somewhere. So I think, you know, we were fortunate enough in that we were able to bring some UK government funding to the process. But you were very proactive in identifying what the funding channels in the university in the hospital might be, and also you had all of the key stakeholders lined up on board, ready to press the green light when we were ready to go. So, I mean, from our point of view, it's been almost a textbook experience, I think.
I'd actually really like to echo that sentiment, Dom. I found it incredibly rewarding collaborating with both you and being shepherded through that process with the ventures team. That's been really enjoyable from my perspective. And I've also enjoyed meeting with the expert advisory board. I think often as a pediatrician, we think of ourselves as really being sensitive to what children and their families need, but being able to hear it from their perspectives directly was just an incredible experience.
And yeah, it was a wonderful experience for the board too. And just for anyone listening and watching, Dr. Stallmorgan attended a meeting very early on in the process where she explained exactly what happens in an end-to-end sedation encounter, and then got loads and loads of questions from our expert advisory board, who then all came up with lots of ideas, many of which made it through into some of the game screens that I've talked about just now.
Well, thank you for contradicting me.
Correct.
We are so excited to also see you, Dr. Stallmorgan, so engaged and excited about this. And oftentimes we do things in the name of patient experience. And to see our caregiver experience in all of this has been tremendously rewarding for us as well. I think I saw a question from, is there one question from the audience?
Could you comment on steps, how the game is created? What factors do you consider while designing the game?
Let me read that question back for our audience, mostly online. The question is, would you comment on steps of how the game is created? What factors do you consider while designing the game? Dom, perhaps for you to answer.
Yeah, so the very first step is to understand the user and understand their needs. So the very first thing we did, partly because of timing, was that expert advisory board session. But then we came over to Cleveland. As anyone watching can probably tell, I'm from the UK. So my team and I came over to Cleveland, and we spent time in the sedation unit talking to patients, talking to parents, and then talking to physicians and understanding their journey, their user journey. We then went back, we developed what are called journey maps, which I won't go into here, but I mean, they basically outline exactly the kind of stages and pain points that any user type experiences as they go through that encounter. And it's only when you've done all of that research, that groundwork, that you can begin to start thinking about what a game might look like. So the next stage after that was to work up what we call a game design document, which kind of synthesized all of that research and put it into a more kind of creative proposal as to how we would approach the problem.
Yeah, and it was wonderful actually also when you visited and you interacted with the nursing team, the child life specialist unique to our sedation service, and really understood the entire journey from end to end. And I think we are so excited to be able to use it because there's so much information that we want to give in such a short period of time. And it is awfully overwhelming to children and their families, and to try to give the information, obtain informed consent, and allay all of their fears and anxieties. It's a lot to accomplish in an hour and a half before they become sedated for the procedure. So I am so excited to be able to use this.
Well, thank you very much. We're excited to learn more about the product as it further develops, as well as the great research that's happening. Also, a quick shout out to our Rainbow Babies and Children's team, Brian Nelson. You've been so integral to the work. So thank you both for joining in, Dr. Stormark and Dom, and we will transition to the next session.
Thank you.
Thank you.